Hi, thank you for tuning in to A Healthier Me. I am your host, Michelle Wakeham, and joining me on the show today is Dr. Verne Weisberg, and he is here to talk to us about his Plastic Surgery Center in Portland and also the Center for Weight Management and Wellness. So please help me and welcome Dr. Verne to the show.
Thank you.
Thank you for joining me today.
A pleasure, Michelle.
Before we get into what you do and talking to us a little bit about your practice, could you tell us a little bit about yourself and your background?
Sure. Well, I started out life in New York State, around New York City. And growing up, I was always interested in how things worked, always interested in fixing things, much to the chagrin of my parents, especially my mother. My father was a little more okay with my taking things apart. My mother always was wondering where all the parts were going to go back. And really, I've always been very curious, and fixing things was a big deal for me. In fact, rather than getting a brand new toy, I kind of enjoyed finding one that somebody had thrown away that had a lot of potential. I could see the potential in it and try to figure out how to fix it. I might not have known how to fix it, but I knew there was potential. So that was always kind of in the back of my mind and my mindset. And I grew up really when most of my friends were out doing a lot of sports. I did some, but not much. I was busy, sitting at my workbench working on little models and tiny things.
Like tinkering around.
Right,
Yes.
right, or working on a car or something like that.
Mm-hmm.
So when I decided to go to medical school, I really didn't know entirely what I wanted to do. In fact, I went to become a psychiatrist, I thought. But my first day of medical school, when we were all standing around, we hadn't even started class, and people said, well, what are you going to do? And somebody wanted to be a cardiologist or something like that. And I said, well, I think I'd like to be a reconstructive surgeon. But I didn't know what that was. I certainly had never met one or heard about it, but it made sense to me to be able to try to fix and put people together. It was certainly a long road from there, but I think just stating that goal kind of basically shaped my future.
Wow, and you stuck with it.
Well, in fact, I started getting involved with that early on in my career, between my first and second year of medical school, as I was working at the VA hospital in Brooklyn. The neurosurgeon there didn't have a lot of help. And I know this is somewhat frightening for people to hear, but he really needed help to just assist him in surgery. Obviously, he was doing the surgery, but there were certain things that, you had to have another extra pair of hands. So the neurology residents weren't always available, and so he asked me and another classmate of mine from time to time to be there and help him, which was certainly interesting, to say the least. Although there's not a lot of moving parts in the brain, so it wasn't as interesting as you might think. At least I didn't find it that way. But it got me to the operating room. And while I was there and walking around, I actually noticed that people were doing some really interesting stuff. I know brain surgery doesn't sound boring, but the real interesting stuff was being done by the plastic surgery residents. And got to talking with them, and they invited me in to watch what they were doing and then to scrub with them, and in fact started to teach me how to do surgery. So I really was learning that right after my first year of medical school.
Interesting. Wow. So you really dove right in.
I did. And I wound up spending my free time down in the pediatric emergency room at Kings County Hospital, helping to repair lacerations for children who had some traumas. They fall down and hit their head, that happens.
Oh, yes.
So I was able to do that in the evenings, and it was kind of my way on through, and I continued to do that sort of thing. In fact, spent the entire second summer of medical school just doing plastic surgery with the plastic surgery service.
Oh, excellent. So it's in a way a training, in a sense.
Well, I've had a long exposure,
Yes. Yeah.
and it really helped to shape where I wanted to go with that.
And where did you want to go with that? What was your goal?
Well, my goal was to be a plastic surgeon.
Mm-hmm.
I certainly didn't know much about cosmetic surgery, for example, and that was a relatively new field at the time, but it was certainly very interesting to me, and that was the area that really got my interest going, especially when in the process of moving forward to become a plastic surgeon at the time, although things are different now. You would do at least 1 or 2 years of general surgery or a full general surgery residency, or you would do a full residency in ENT, ear, nose, and throat, or at that time you could also do residencies in orthopedic surgery and OBGYN.
Okay.
No, most of those pathways aren't available anymore, although basically today either you do general surgery or ENT, or more likely nowadays there are integrated programs where right from the get-go you're going to be a plastic surgeon, so you have a program that sets you up with the prerequisite years that we feel are important for a plastic surgeon to learn the skills of taking good care of people, understanding how to deal with illness and disease, and understanding how to work under pressure. Mm-hmm. And then the years thereafter, several years thereafter, of focusing specifically on plastic surgery, whether it's hand surgery, wound care, surgery for congenital problems, birth defects, things like that, and of course, aesthetic surgery.
How do you go into that field and study and say that I want to focus on this part of plastic surgery or this part of plastic surgery, or is it all under one umbrella?
Well, one of the big draws for me to be a plastic surgeon was the tremendous variety, and I think if you ask any plastic surgeon, that's really what you're going to hear, is that there's such variety in what gets presented to you on a daily basis. It's not always the same thing. You're not always looking at somebody with a hernia or somebody who has a gallbladder that has to come out.
Exactly.
You never know what you're going to see. And since people are so different and issues are different, or the various areas of the body are different, it's always a challenge and you know, a stimulation to your creativity. And I think you have to be really creative to be a plastic surgeon.
So here we are. You're in your field. What was your motivation to start your practice here in Maine?
Well, interestingly, I thought I would be teaching. As much as I enjoyed working with the residents and doing some teaching, what I really enjoyed most was my interaction with patients, with people who had issues or people that I could help. Mm-hmm. You know, and really my focus has been through my entire life how to help other people. And that's really, I guess, my mission. Mm-hmm. in whatever way possible. And that kind of interaction with people and trying to make it a great experience for them and allow them to achieve the changes that I felt that I would be able to help them with drew me to private practice. So I had a dear friend and co-resident when I was at Yale who moved here to Portland at one point and invited us up to visit, and we loved it up here, and he said, you know, why don't you come on up and we'll work together like we did at Yale, and so I did. Mm-hmm. And it's been great, you know, and it turns out that there was I think, a great need. And when I first came here, everybody said, well, nobody wants to have cosmetic surgery in Maine. And in fact, when you would talk to people at plastic surgery meetings, they go, Maine, really? You must have a lot of trauma or a lot of hand surgery. And certainly at the beginning of my practice, I did a lot of that. But from the beginning, people were very much interested in being able to correct things that were making them uncomfortable, or things that were having an impact on their confidence or their self-assuredness, and everybody thought they had to go to Boston. And so they were really excited to be able to have something done here at home, close to home. Their families could be with them, take care of them.
Yes, most definitely.
And to be able to receive care that was appropriate for them and of high quality.
For someone coming into your office, what can a patient expect?
Well, anybody coming into my office can expect to be treated warmly and as family. And that's really been our guideline all along, is to try to maximize the comfort and the care and the concern for each individual, so that you don't feel like you're going to a doctor's office. It's really we like it to be more and more out of the box, and we continuously strive to make that experience as good as it could be, and think about ways that we can make it even better, so that when somebody comes in, they're greeted warmly, as if they're an old friend or a favored relative.
Right.
We don't always love our relatives, I guess, but and for example, you're greeted by a lovely person who's going to assist you with any paperwork that may perhaps need to be done, or offer you a cup of coffee or tea or something like that, and then as you get to relax, you get to meet with one of the patient care coordinators, who will just sit and get to know you, and that's important for us, is to get to know people and understand what's going on, and really to be able to focus, so that when I'm sitting with someone, I can really focus and understand who they are, what's going on for them, what they want to find out, and what issues they want to discuss.
What kind of procedures do you offer?
We tend to focus, obviously, on pretty much aesthetic or cosmetic surgery. Both are the same term. Some of us like to call it aesthetic surgery, some cosmetic surgery.
Oh, okay.
But there are also non-surgical alternatives. We also look a lot at lifestyle, and for that reason we have a Center for Weight Loss and Weight Management and Wellness, in order to help people, because not everybody really is going to be able to achieve success with liposuction, for example.
Right, a lot of, like you said, lifestyle changes, diet changes need to take place for it to work out for the long term, correct?
Well, and many
well-being.
people are confused and really don't know how to go about achieving that sort of goal. How do you go about losing weight?
Right.
For many years, people would come to see me because they thought they needed liposuction or a tummy tuck, and clearly they needed to first and foremost lose a fair amount of weight. And I was very frustrated, because really I didn't know what to tell them to do. I would say, well, why don't you go find a nutritionist or work with a trainer and come back when you've lost 40 pounds. Liposuction is not a weight loss procedure. Liposuction is designed specifically for stubborn areas of fat.
Okay.
So something like on the hips, or the little lower belly, or maybe under the neck, or the arms, or something like that. It isn't you're not going to lose 10 pounds from liposuction.
Okay.
Well, I mean, you could, but it's not necessarily safe. So the key for everything that we do is to have absolute safety. So we want you to be in your best condition. We want you to not have any significant medical issues whatsoever. We want to be sure that within all the power that we have to control, all of those potential health factor variables are held constant so that they're not an issue and not going to negatively impact your health. Obviously, we're talking elective surgery. We want you to be safe.
Right.
And safety is prime. You have to be safe. So in terms of liposuction or preparing, I mean, the real key is to be at a good goal weight. Generally, certainly the anesthesia guidelines are to try to stay below what's called a BMI, body mass index, of 30. And that's really been shown to decrease the potential for complications related to anesthesia or surgery. But it's a pretty good guideline. But we like people to be healthy, and we like people to not have significant, obviously, heart disease or diabetes can complicate things. High blood pressure can complicate things.
So any underlying health conditions are important to know or have taken care of prior to?
Absolutely.
Okay, that's good information to know. You touched upon anesthesia a little bit.
Yes.
Do you have to go under a general anesthesia when having a procedure done?
No, you don't.
Okay.
No, you don't. And the anesthesia that we generally use, and we have a fully accredited private ambulatory surgery area for specifically just for our own use. It's ours, and it provides real privacy for patients. And we have one anesthesiologist, Dr. Frederick, who we work with exclusively, who really has, I think, pioneered and perfected a type of anesthesia where people are not given any medications that can make them sick to the stomach. There's no narcotics.
Great.
It's extraordinarily safe, carefully monitored, and in fact, we are an accredited teaching campus, if you will, for UNE's nurse anesthesia program. So very frequently the senior nurse anesthesia students come to learn from Dr. Frederick how to do this ambulatory anesthesia, whereby the combination of good local anesthesia and deep sedation called TIVA, total intravenous anesthesia, you're breathing for yourself. There's no breathing machines, no gases or anything like that. And the recovery is remarkably quick, and people just feel great right afterwards.
It's amazing. It really is.
So, and it's really safe. We have no triggering medications that would cause anybody to have issues generally with other things, with other problems that can occur with general anesthesia.
That's wonderful.
And of course, comfort is key, and I would say that at least 95 to 98% of our patients have no pain or discomfort afterwards. Certainly when initially, right after surgery. Obviously, you know, you may have some soreness and occasionally, because nothing in life is absolute. There's always a bell curve, and some people, the majority of people, are extremely comfortable, and some people are so comfortable that they have no pain whatsoever, and some people will have some pain or feel like they need some pain medication, but very little is used.
It's amazing. It's amazing how far we've come with things like that. To talk a little bit about your Center for Weight Management, what type of questions would you ask an individual? What kind of things would you need to know in order to customize a certain diet plan or meal plan per se?
Well, first of all, most people are very challenged to lose weight and keep it off. It creeps up on us because the foods that we have are not really, that we commonly think of as food, are not really food. They're they're designed and we're marketed to believe that these are things that are good for us to eat. I mean, you have sugary cereals that now have the American Heart Association stamp of approval.
You're
And
right.
that's crazy. I mean, this just is, it shouldn't be. I mean, the problem really is that we've really forgotten how to feed ourselves as wild human beings, for example. I mean, we're not familiar with what grows in the wild. We don't know what wild food is. You know, when was the last time you walked through the woods and saw a cabbage? Not a skunk cabbage, that's not a cabbage. When was the last time you saw a wild broccoli? I mean, those aren't wild things. And pretty much most of the foods that we think are very different really aren't, because we've designed them that way. We're humans, we tinker. We make things the way we like them to be. We make fruits that are bigger and sweeter. We get rid of the sourness. We get rid of the seeds. We, make them tasty and sweet and juicy. But that really defeats the true nutritional value of a lot of those foods. And so we look at them and go, oh, that's great. But, you're eating basically, nature's candy.
You're right.
Oranges, and nice big juicy pears. I mean, you can't just go crazy with that. And the same thing with, our animals. The animals are different from the wild animals that we would naturally eat. So
That's true.
a big portion of what we do is really helping to educate people about what is appropriate for humans. What do we really need? Do we naturally find vegetable oil in the world? No. Do we naturally find things that are fat-free or low-fat? Probably not.
No.
And most of these things that we've been told for the last 50 years or so are good for us really are heavily processed and have actually had the opposite effect of, rather than causing us to lose weight and be healthier, it actually causes us, for the most part, or most of us, to gain weight in ways that we really don't understand, because we think we're doing what we're supposed to, and we go out and we do tons of cardio and can't get rid of the weight. And our obesity rates are going up. We eat less fat than we ever did 50 years ago or 100 years ago. And we're not healthier, and we're seeing earlier diabetes, and we're seeing neurodegenerative diseases because we've removed the healthy fats.
There's so much conflicting information out there with the fat-free and low-fat, and how that is, a lot of people think that's the safe way to go. And how do you redirect that?
Well, people really have to trust in what you have to say and understand why it is, and basically get an idea about the science. It's, most people really don't want to hear a lot of science, because most of us really, it wasn't what we might want to hear. I mean, for me, science was everything. Everything that I was interested in throughout my entire educational career, I loved science. Not math, but I loved science. So, and I think the science thing just goes back to my desire to understand how things work. Why does this happen? Why do we think that?
Right.
So I don't want to overwhelm people with the science of why, but you have to have some sort of basic idea. You have to have an idea or an understanding about how foods affect the really probably most significant hormone in weight gain and development of diabetes, which is insulin. And insulin really regulates our entire fat metabolism. It's a very important hormone, probably the most important hormone when it comes to weight and nutrition.
You had touched upon a little bit of, you mentioned BMI. What exactly is BMI, and how is that measured?
Well, the body mass index, it's really a function of your height and your weight. It's not a great measurement, but it's used a lot, and so it gives some sort of frame of reference for people.
Okay.
Sort of like saying your LDL cholesterol. It's
Oh,
measured a
okay.
lot, but it has a bunch of things in it. It's not very precise for anything unless you're really drilling down and doing a very specific test.
Oh, okay. Um, uh, Calories. How do calories come into play when it comes to managing your weight?
Okay, so most people grow up thinking, if you eat fewer calories than you expend, you're going to lose weight. And I mean, it makes sense intellectually. But the problem is a calorie is not a calorie. It's what those calories do to you, how your body processes them, and primarily, what do they do to your pancreas in terms of producing insulin.
Oh, okay.
So, for example, whereas people will tell you that you'll get 9 calories from a gram of fat, and you'll only get 4 calories from a gram of carbohydrate, wouldn't you want to have carbohydrate instead? So you're eating, but the problem is the carbohydrate raises your insulin level, which then drives all of that sugar into being stored as fat. The fat that you eat does not stimulate your pancreas at all to produce insulin. So
Okay.
that fat doesn't really get stored as fat. So you aren't what you eat identically. So you don't get fat from eating fat. We develop fat from eating things that are converted easily to sugar.
Okay. And what types of things would be easily converted to sugar?
Well, obviously sugar,
Sugar.
sodas, most,
Refined sugars.
any sugars.
Any sugar. Oh.
They all do the same thing.
Okay.
Fructose is particularly problematic because that actually has to go through the metabolism in the liver to be converted to the sugars that we can use, and that stresses the liver out, similarly to the way alcohol is detoxified by the liver.
Oh, okay.
So all of that high fructose corn syrup and fructose from fruits really is not the best thing in the world.
Huh. Interesting.
And our biggest offender really are the starches, and specifically wheat. And wheat brings with it its own set of issues.
Will that be because of the gluten in the wheat?
Well, gluten is one of the 47 proteins that the modern wheat makes. The original wheat, when for some reason our ancestors started to grow it, was a grass called einkorn. And there is still einkorn available, but it's not easily or readily available. The einkorn had, I think, about 17 proteins that it made. In other words, 17 genes. And as we tinkered with it, as humans do, and everybody thinks that, well, now we do genetic modification, but we've always done genetic modification to a degree in terms of our horticultural practices, the way we crossbreed and hybridize vegetables and animals, trees, pretty much anything. Because again, we tinker.
We do.
If something's good, certainly we can make it better.
Of course.
So, I mean, that's why we have all the little cute little dogs or big dogs. Some people like big dogs, some people like little dogs, some people like dogs with hair, dogs with fur, cats that have a lot of hair,
No
animals
hair.
that have hardly any nose. I mean, it's all a matter of selection in terms of what it is we like, and we're very competent in changing our environments all around. So the problem with wheat is over the years we've gotten it to be more robust in terms of the availability of the starch. Because we're not cows. We can't really eat grass. We don't have 2 stomachs. We can't spend all of our day chewing and digesting.
Right.
Okay, so we can't digest grass. You know, what happens when your dog wants to, feel better? It eats grass,
It's grass, yeah.
and it throws up, right? So Dogs can't eat grass, people can't eat grass, but we figured out that if you grind it down, you can get rid of all the stuff, and there's that kernel of starch that's easily converted to sugar, and therefore the sugar is converted to fat. Now, for most of human history, fat's been an incredibly important thing for us to be able to store. So we're really set up well to store fat to prevent our dying from hunger in times of famine, right? So that would be, anything that would, any food that would help us to store fat, especially when food becomes more scarce, is something that we naturally are drawn to. And our bodies really don't know any differently. So even now, the fact is, we don't really generally face famine or times of hardship in that sense. For pretty much most of us in the Western civilized world, food is available 24/7, 365.
Yes.
You're hungry, 3 a.m., go to the fridge, you can eat something.
Mm-hmm.
You're, driving along the road, there's usually some place that you can pull into. Now, probably you could just pull over and find some wild food to eat if you knew what to look for, but most of us don't, so we panic when we're on a long stretch of, say, the main turnpike and there's nothing to eat. Right. We worry that we're going to be hungry, but for the most part, we don't face that sort of problem. But our metabolism is set up in such a way that we favorably try to store fat, and we really, our bodies do not want to give that up. And in the presence of insulin, which you remember is the problem causing us to gain fat,
Yes.
fat cells cannot release fat.
Huh.
So it's a kind of a paradox.
Yes.
Okay?
Wow.
So you can't eat things that stimulate insulin and expect to lose weight. And that's one of the things that we find with people who have diabetes. Initially, many people who develop diabetes actually start to lose weight because their insulin is not being effective. Mm-hmm. When you start taking insulin, that insulin starts to really add up, and people find that they start gaining weight significantly, which compounds the problem.
Mm-hmm.
So.
Interesting. Okay. So that brings me to the next question. With exercise, how important is it to incorporate exercise into one's daily life or daily routine?
Movement is very, very important.
Okay.
And it doesn't have to be going crazy at the gym. Gym memberships are a pretty modern invention. Exercising is a modern invention. Stretching is a nice idea, but also a modern invention. I'm pretty sure that, when humans were walking, through the forest or somewhere out in the wild, and suddenly there was a lion or a rhinoceros coming after them, they didn't say, hang on a minute, I got to stretch a little bit, let me,
Yeah.
Now I'm ready. Let
Right.
me warm up a little before I start sprinting.
That's true. Good point.
Right? So we're designed, and I mean, your pets don't do that.
No?
I know my dog will get up, from a deep sleep and launch himself somewhere if he thinks something's going on. He doesn't come back limping and going, oh man, I should have stretched.
Right, that's true.
But exercise itself, especially what we'd call chronic cardio, mm-hmm. where people are just constantly out there and spending hours on either a treadmill or an elliptical machine or out pounding the pavement for miles and miles and miles. Mm-hmm. And I mean, I've run a couple of marathons, so I understand all of that, and it's addictive, it really is. But that's not what's really good for us, and what's natural for us to do are things that are more the high intensity interval training is what you might call it now. Okay, so sprinting, like moments of panic, kind of, oh, I better get out of here because I'm gonna, get killed. Uh-huh. that actually works favorably. We're designed to respond to that. We're designed to climb things. We're designed to have fun and to play. So if you look at children, what do children do?
They're running around.
Well, nowadays they don't, but traditionally children will just go and play, and they'll run, and they'll tumble, and they'll wrestle with each other, and they'll climb stuff. And that's what we're pretty much naturally designed to do. So we're designed to lift heavy things. We're designed to do bursts, short, quick bursts of maximal effort, followed by a significant amount of recovery. Because by nature, humans really like to just hang out, talk to each other, whatever. We're not really designed to work all the time, okay? And that's a function of our industrial society and training people to work in factories. We don't have that many factories anymore, but we still have that work ethic now designed for factory work. So we wind up actually overstressing ourselves, and that stress and lack of rest and that anxiety increases our cortisol levels, which then causes us to increase our insulin and actually hold on to fat. That contributes to fat storage as well.
Interesting. So a chronic cardio, as you called it, that's interesting, can actually work against you.
It can.
Huh.
Because of the stress, and also you wind up creating a lot of what are called free radicals, which are very damaging. And especially when you add that into the types of things that we generally consider important to replenish, say sports drinks or gels, or the carb-loading pasta meals and things like that, that give us an issue with something called AGEs, advanced glycation end products. So it's an oxidation of glucose, which actually causes severe damage, not only to the insides of the linings of our blood vessels, but our joints. It causes aging, and that's a big factor in why some people, and you'll see they're very healthy, right? So you look at them, you go, oh, that's a runner. They're really skinny, but they're also pretty, they age early, they wrinkle early. Their skin is loose because of this oxidized glucose that attacks and breaks down the collagen in the body.
And that, you say, is found in the sports
Well,
drinks, like
yeah,
your Red Bulls and things like that? Or?
I'm not sure about Red Bull, but certainly the classic
Gatorades,
Powerades, juices, especially concentrated juices like orange or apple or cranberry that people like to drink. Or after a workout, they'll have a meal of pasta or some sort of carbohydrate. And in fact, that type of activity tends to naturally drive us toward seeking carbohydrate.
So it makes you crave it more?
Yeah.
Basically. Wow.
Well, what do we call it? We say you work up an appetite.
Work up an
right?
appetite, yes. Huh.
So if you were going to have a meal, your husband's taking you for this special meal, and it's going to be at the best restaurant, and it's way out of your budget, but it's like really special,
Yes.
and the best food ever. What would you do during the day? Would you eat?
I would personally.
On your way. Well,
Yes.
most people would want to be pretty hungry by the time they got there, right?
Yes,
you
they
don't
would.
want to overdo it during
Right.
the course of the day, right? So you really you want to work up an appetite, right? So you work up an appetite so that you can eat later. And if you don't eat during the day, you wind up eating more at night. And a lot of people have that sort of issue. They're running out of the house, they don't have time for breakfast, they grab a little something for lunch that's really nothing. So by the end of the day, when they get home, they're hungry, and their bodies think that they're starving. So they eat too much, and most of what they eat winds up, because of what's available, being converted to fat because your body thinks, well, now we really need the fat because, there's no food available.
So it's going to store it because your body's thinking, I'm not going to get fed for another so many hours, so
Right.
we're going to store it right over here or wherever.
Well, there are certain areas that men and women generally store fat differently.
Okay.
Until we get old, then we're all look alike. But, women are genetically predisposed to storing fat in different areas for various reasons that may or may not be correct. But the concept is that the reason that women tend to round out around the hip area is to give the impression of greater ability to have or bear children, more fertile appearance, or at least in the way that we think of each other.
I've heard that before.
On the other, on the other hand, what I like to say is that men are designed to look the way men look because that's what women are looking for. And I know, please don't write in. But in the animal world, in the world of nature, the tendency really is, for example, like the peacock.
Mm-hmm.
There's no real advantage to a peacock having this stupid big feathery tail, except that the women find that attractive. The females, the peahen, finds that attractive, and they selectively look for that. It's not like the males said, this is how we should look. The females say, this is what we're looking for, so if you're going to look like that, that's what we like. And so selection tends to produce that. Now, there's a thought, and I know I'm kind of rambling here, we're going a little astray, but there's a thought that one of the reasons that has worked out for the peacock, for example, is that if you are a male peacock, well, peacock is a male. If you're a peacock as opposed to a peahen, if you're a peacock and you've been able to maintain that nice tail through the winter, you're healthy. And so the female is attracted to the healthy, fittest looking male in their minds. Of course, having that big, bright tail certainly makes you more obvious to prey. So,
Catch-22.
Well, and there's a downside.
Yes.
There's a downside to that. So, in terms of how men and women are different, we're kind of designed to be attractive to each other. And men don't design themselves to be attractive to women. Women design men to be attractive. Yeah, I like those.
Yes,
those
I
are
like
nice,
those. Right.
And men, are, I guess, designed to appreciate certain aspects of beauty. And beauty actually is cross-cultural. Through all cultures and appearances and parts of the world, there are specific proportions and ratios of beauty.
Most definitely.
And a beautiful person is always a beautiful. People are perceived as beautiful, and it doesn't matter their background, by certain shared proportions and ratios, which is certainly interesting as well.
It is very.
Which then brings us back to plastic surgery.
Yes, it does. Back to plastic surgery. Let's talk a little bit about facelifts. Why would one want to get a facelift?
Well, there are lots of reasons, and everybody has their own reason as to why they want to do something. And most people they don't spend their lives growing up saying, I'm going to have a facelift when I get to be 50 or 45 or 65. They really go through life saying, I feel great. And what happens is people feel great and they catch themselves in a mirror, or what's better yet nowadays is they're Skyping or FaceTiming with their friends and relatives, and that picture, especially when you're looking down, is not really what you want to see. And they catch themselves and they go, wow, how did that old person get in my room? And it's not the way you feel. you know, and it's really, it really affects your self-confidence for pretty much everybody if you're not looking the way you feel. People don't want to look tired or angry or sad, especially if they don't feel that way.
Exactly.
They want to look, they don't want to scare little children, you know. And these are things that people tell me. I'm not making this up, you know.
I'm sure.
And that really drives people to consider ways of being able to improve that and to restore the way they used to look. And that's the key to
How they feel about themselves.
well, it makes a big difference.
It really does.
It makes a big difference. And having that confidence to allow the inside to come out.
Most definitely.
And to be accepted, because as much as we like to think that it doesn't matter how people look in terms of how they relate to each other, it does. And we relate to each other based on looks. You know,
That's
and
it.
you study it, and it starts with children. The studies have shown that children have a distinct concept innately of what's attractive, what's not, what they like and what they don't like. And that stays with us, and we're hardwired for that. And there's not, you may say that we should fight that or resist, and people are welcome to do that, but the majority of people really do have, we operate from who we are, you know, and we do judge people, and we are judged, and we try to put our best face forward, our best foot forward. We want people to not be looking at something. We want people to be able to hear us, right? You want to be able to hear what the other person is saying or be heard, and not have somebody sitting and going, wow, you know, why should I listen to that person? They're really mean looking.
You're right.
You know, or, you know, why would somebody, you know, say, well, I don't like my picture. I don't want my pictures taken. You know,
And you
or,
hear that a lot.
right.
You do hear that.
And, you know, a lot of people will come to see me because they were, say they were at a function, at a wedding or something else, and somebody took pictures and they saw these pictures of them from the side, and they realized, you know, I can't stand the way my neck looks, or my nose is too big, or, you know,
Chin or
a
what?
bunch of other possibilities, or how they look in clothing, or how clothing fits, or, you know, people will be just frustrated that they can't buy clothing that looks nice. It doesn't fit them. They have to disguise something. You know, there are a lot of reasons why people seek cosmetic surgery. And it's kind of a shame to call it cosmetic. It's not like, you know, putting powder on, although we've been doing that for all of human history. In fact, I'm pretty sure the Old Testament suggests that a woman must be allowed her makeup.
Really?
Somewhere in there, there's a reference to makeup.
Interesting.
Yeah.
That is interesting.
But we really, you know, we really present we present ourselves in some fashion or another. Okay, everybody is pretty much subject to this. We don't go out of the house dressed a certain way. We take care of how we look. We take care of, you know, how we are perceived, and even people who say they don't care about how people look at them, and maybe there are people who don't. They like that. They may like feeling that way of being different or special. That, you know, well, people have to accept me on my terms, and which is fine. Everybody's entitled to do what they want to do as long as they're not hurting anybody else. But for the most part, if we weren't really, what's the difference between, you know, getting your hair colored or straightened, or putting on makeup,
Whitening your teeth.
putting on rouge so that your cheeks look healthier,
Right.
getting a tan or using a self-tanner. It's all the same. It's different portions of the spectrum of how we present ourselves. You know, and I mean, obviously, there are going to be people who take it a little bit far, you know, and look odd. And I think that for a while, at least in Hollywood, people were kind of looking at each other and going a little out
Oh, yeah.
off the end, you know, especially with their lips.
Oh, yes. It almost becomes a competition or something, it seems.
Yeah, kind of like that. But
Yes.
for the most part, I think people have come back to earth a little bit, and pretty
Yes.
much everything starts, every trend tends to go a little crazy and then kind of
Backs up.
comes back to where it probably needs to be. So there tends to be an overuse.
It's true. Well, I think it's great what you offer. I think if anyone can go and regain a sense of self and regain their self-confidence, I think it's amazing. I said, why not? It must be a very fulfilling, kind of very good feeling that you must get, knowing that you're helping people regain that confidence and feel
Well,
good about themselves.
And that's really the key. What I say is really we're not in the surgery business. We're really in the, what I do is to help people regain their self-confidence and really regain that ability to function without thinking of some sort of physical aspect of their lives.
It's really great. Is there anything else that you'd like to add?
Are we done?
Well, I believe they gave us a signal that our time is close. So
Good.
before I close the show, I'd like to offer you to add anything else to the show before I close.
Something to add. Well, I think it's important for people to understand in whom they should place their trust for their care and their treatment. Unfortunately, although Maine is somewhat isolated and protected, out there in the world, there are a lot of people who say they do things or can do things that maybe they're not really trained to do, or they suggest that something that they can do will achieve results that really are not realistic, that they're not really going to see results because, you know, non-interventional techniques can only go so far. Certainly we can do a lot of stuff with non-interventional things like fillers and you know, wrinkle reduction, wrinkle blocking with Botox or something like that.
Okay.
But there are limits to that, you know, and there just comes a point where the only way to really correct something is through surgery. Now, the key really is to make sure that that surgery is not something that's really visible, that you don't see scars, that people still look like themselves and look natural, because that's really, good cosmetic surgery should not be visible. So
Okay.
you shouldn't really notice,
Okay.
like Kenny Rogers, Joan Rivers,
Yes.
which people are what people say, I don't want to look like that. You know, and there are lots of people, and they say, well, you know, that's what happens. That's not really what happens. That's what happens when something is either not right for that person, or you get carried away, and one step, you know, leads to another, and you know, that's not the norm. That's sort of, you see the outliers when you see that sort of thing. So the majority of cosmetic surgery that we see in the world is really very good and not visible. You just go, oh wow, they really look good.
That's a good point.
I mean,
That's
you know,
important.
Cher, Jane Fonda, they look really good, right? They don't look like they've had work done.
No. What are some of the latest technology in cosmetic surgery?
Well, the thing that excites me most right now is something that gives us the ability to treat an area that's been really problematic for people, and that's loose skin. We've tried to approach that through techniques that are more external, so with with laser or other types of radio frequency devices that try to transmit the heat and energy through the skin. The problem with that, because what we're trying to do with tightening, to tighten is by heating the collagen in the deeper layers of the skin. That causes a controlled amount of shrinkage, kind of like when you put a piece of bacon in the in your pan, and it shrinks down. The heat causes that collagen to tighten.
Okay.
But we don't want to burn. If we're trying to apply that energy across the skin, we have to be careful not to burn the skin. So there's been a lot of technology applied to that to cool the skin and ways of trying to have minimal damage, but really that energy needs to be applied from underneath. So now with the new TherMe RF, the radio frequency, through just something that's just like an injection needle that has a heat generated and monitor right at the tip, we're able to use just this very gently, pass this through and apply the energy under the skin, monitoring very precisely the temperature to which we raise those tissues, and in fact wind up not just tightening skin, but we can melt fat, and monitoring as well from outside with an infrared camera. We make sure that the skin temperature never goes to anywhere near where it would be in danger at all. So it's safe, it's incredibly safe and comfortable and very effective, especially in the areas that are exciting to me, aside from obviously the face and the neck, to tighten these areas without having to do a lot of additional, more traditional liposuction, for example. The areas like the wrinkling skin above the knees can get tightened, and I think actually there's going to be a segment on that next week on the doctors.
Oh, great.
Yeah.
Okay.
And that little back skin that hangs over the bra, a lot of people have issues with that, or the skin in front, where the TherMe RF is able to cause that skin to tighten and shrink down in a safe fashion. That's something we've really not been able to do to help people with.
That's really impressive. It's amazing.
Yeah.
Thank you. And my final question to you before I close the show is, what advice would you give to someone considering plastic surgery?
I would advise that you do your research.
Okay.
Try to understand as much as you can, but be very careful, because the internet is the Wild West. There's a lot of misinformation, and anybody is able to voice an opinion or be an expert on the internet. There's no, there's no control for who should be giving advice. So be really careful about that. Really research the credentials of whomever you choose to talk to, and get information, and go. You have to be somewhere where you feel it's right. Okay, so the key is, if you have the right feeling about the place and about the doctor, whoever he or she would be, if you'll know if that's the right person for you.
Okay. Great.
And be sure they're board certified by a real board.
Okay, so board certification is a big thing.
It
Yes.
is. That's,
Okay.
well, it's a start.
Okay.
I mean, there's, look at that, look at experience, see before and after pictures, see if you can talk to previous patients.
Testimonials, perhaps, things like that.
Well, it's important.
Yes, definitely. Thank you so much, Dr. Verne.
Pleasure.
I appreciate you taking the time to join me today.
Great. I hope I didn't wander off too much.
No, not too much, and I would love to have you back at any time to talk about anything else that you would like to discuss. I think it'd be great.
Thank you.
You're welcome. And to everyone at home, thank you so much for watching. I hope you enjoy the rest of your day, and see you next time on A Healthier Me. Bye-bye.
Bye.